Hello, this is Donovan Bigelow again, and this is the second lecture on sexuality, covering the material from Dr. David Scharf's book, The Sexual Relationship. Chapter 4, Separation and Individuation. The first thing he addresses in this chapter is the role of the father in attachment and separation. If you listened to the first lecture, you heard almost the complete dominance of development in the from the perspective of the child and the mother. I don't think I mentioned the father's role a single time. I think what we've had now culturally is quite a swing. We started with Freud, who, in his Victorian prejudices, privileged the role of the father almost exclusively. We then, for several decades, and the works of Melanie Klein, saw an almost mirror image dominance in child development theory on the primacy and importance of the mother. I'd like to think that we are now back in the middle, where the respective roles of both parties are understood. And I think that's where we are. I think Scharf recognizes that there is a central, meaningful role to play for a fathering figure in the life of the children. And it has a couple of elements that need to be understood specifically. The first is that the father operates as a container for the mother and the child. The great British psychoanalyst Bion, came up with this idea of the container and the contained, a way of thinking about the emotional interaction between a mother and a child. In addition to that, the mother, the container of the child in all of its direct importance, has to herself be contained. Winnicott came out on stage one time and said, to start a lecture, "There's no such thing as a baby." And everybody fidgeted around wondering, what does that mean? And he then went on to explain, there's only a mother and a baby together. A baby by itself is inconceivable, doesn't exist, can't exist actually. I think Bion's idea of container-contained reflect that. Scharf's idea is that the father's role is to contain the container. And I think that feels absolutely sound and appropriate. It isn't, I will add to Winnicott, if I can dare do that, there's no such thing as a single mother. It isn't possible alone, for any single mother alone, to do all of the relational and caregiving dynamics a child needs to grow into healthy adolescence and adulthood. It is absolutely impossible, given the intensity and the profundity of those childhood needs. So the mother herself must have containment. There's no such thing as a single mother because there must be some, traditionally it's been the father, but these days there must be some network of support to contain the mother's efforts. If she doesn't have the ability to focus, to be that one mother the child needs to take in to have a consistent sense of its growing self, then the child's in trouble. So the father's role is to first allow the mother to do that, give her the containment that allows her to focus those intense energies on the child's development. The second role of the father, and I think this also intuitively sort of makes sense to anyone who's been a father, or to anyone who's watched a present father interact with children. Plenty of child research now showing the emotional differential between a mother and a father. A mother with a child tends to be containing and soothing and calm and providing of a safe environment. But there's more male energy, not surprising, in the father figure. That children react to a mother often with a kind of soothed calmness and interaction, and they meld into each other. When the same child is with a male figure, a father, the child's energy level is up. They do more. The infant observation and child observation researchers have been very meticulous in their observations of children. And what we find is that there's, I don't have any other way to explain it, this male energy that evokes in the children more activity, more behavior, more directed attention. And I think the researchers are correct in that what that also does in the child's mind is provide an object that's interesting, seductive even. And it pulls that child out of the symbiotic oneness with the mother. All right? Now, it also, and that's childhood development sort of in its basic form. But what else does the father do? The present father solidifies in the child's mind the what Klein called the combined parental object. How does a child come to know what love is, what loving relationships are, what intimacy is? And the answer is, unless that child can take in, introject, identify with that kind of experience in its home, it has no template for achieving that in the outside world in late adolescence and adult. You can't give what you haven't been given. And what the father, together with the mother, does, is supposed to do, has done perhaps traditionally, is provide that child with a template of the loving couple. Which child, when he or she grows up, has then an unconscious place to resonate with when he or she meets a potential suitable partner. Unless they have that internalized loving couple, it's very difficult for adolescents and young adults to connect with someone in a healthy way. Another element that the father helps with is in the separation individuation phase of development. The father provides a place for the child that is safe, that facilitates the separation from the mother, a central developmental achievement. The period from 6 months to 24 months or so, that separation individuation phase, absolutely essential for the solidifying of a sexual and integrated identity. The father's job in that is to manage that separation and provide the child an example of a healthy connection outside the oneness with the mother. If separation cannot be accomplished appropriately in a healthy way, then we end up not being able to connect with adult, late adolescent partners sexually. There is a direct connection developmentally between the child's successful navigation of the separation individuation phase and the late adolescent, early adult achievement of intimate sexual connectedness. The idea here is, and again, once it's said, it sounds kind of intuitively obvious. If there's no separation, there can't be any coming together. And it is in that hopefully healthy maneuver away from symbiotic oneness with the mother, through the various difficult, sometimes phases of separation and individuation, where the identity of the child is solidified as an independent, autonomous self. Still connected, of course, to the mother and the father, but not in that glomming, sort of symbiotic oneness style of very early childhood. If that separation can be accomplished successfully, then the bedrock for a coming together, a coming back together in sexual connection is possible. If the child was not in a household that allowed the developmental separation, then you can see almost directly that there's going to be difficulties in the sexual development of the adolescent. And I think this manifests itself in my clinical practice and in a lot of people's lives with the inability of adults to separate from each other. You see this all the time. The spouse that calls his or her partner 6 or 8 or 10 or 15 times a day, the partner who can't help but sort through the partner's clothes and check their pockets and check their phone records, that inability to imagine themselves separate, that need to keep the boundaries overlapping, and the aggression, the almost hysteria around the threat of separation can be seen in a great deal of very destructive adult behavior. I think this is where most domestic violence comes from. A man and a woman who come together, and this is in large part the subject of the lecture, Fusion and Merger in Intimate Relationships. If they have not navigated, with the help of a loving mother and father, the separation phase, their identities aren't entirely separate. Therefore, a relationship that is threatened feels to them as if their identity is being threatened. And that evokes way too much primitive aggression and hostility and often violence to re-cement that symbiotic oneness with the partner, which is tremendously unhealthy, which is pathological. And I think everyone knows in adolescence or adulthood stories of, or perhaps personal experiences of, relationships that perhaps weren't the best, but then when they broke up, people respond in ways that can be described quite fairly as almost psychotic in their dysfunction, dangerous in their violence. And there is no question now in the research, at least to me, that that reaction is the reaction of a baby torn away too soon from its mother in a way that evokes the kind of psychotic terror that only a baby can feel in the presence of annihilating abandonment anxiety. That feeling of the baby, the terrifying sort of existential threat of annihilation, which is what a baby feels and has no ability to contain, is evoked in adulthood when a partner breaks a relationship. The catastrophe of the lost relationship reiterates the catastrophe of the lost mother in childhood if that separation individuation phase has not been adequately traversed. I have to say something now about mourning, grieving a loss. If this accumulation theory, if this object relational theory is useful and if it's mostly accurate, then there's a bit of a realization that every developmental step has to include an element of mourning. Because inevitably, if you gain something, you've lost something. The child who loses its symbiotic oneness with the mother has lost something profoundly meaningful to that child. And so each and every developmental phase has to include, in order to be healthy, in order to be meaningful, in order to provide a bridge to the next level of maturity, has to include a conscious, I think, experience of mourning of what was lost. The philosopher Nietzsche said once, if a temple is to be built, a temple must be destroyed. And I thought that was purely psychoanalytic, that we cannot erect a new structure without tearing down an old structure of mind. And I think developmentally that makes exactly the same kind of sense, that the child must mourn the old connections if a new, more mature, even if they're better. It doesn't mean they haven't lost something. So this also explains why change and growth is painful, difficult, often with great aggression resisted by everyone. Because we don't want to mourn, we don't want to feel sad, we don't want to feel a loss, we don't want to feel the pain, especially of a profoundly important relationship and its end, its destruction. But I think that may be the very core of why patients don't proceed as quickly as they might in therapy, or why people keep making the same mistakes over and over in relationships. Same idea. They do not have access. They aren't strong enough. They haven't been helped enough to be able to find the strength to consciously grieve and mourn a meaningful loss. Change and growth equals loss, which is painful and therefore resisted. I used to always wonder, how is it that pain is so difficult? If you tell somebody a better way to do it, why don't they just understand that and do it? This is one of the key sort of tipping points in my development, when it became clear to me that my cognitive skill seemed to be completely useless. I understood what prior behaviors weren't good, and I understood what would be better, but making that leap seemed impossible. I seemed stuck, and it made no sense. I just assumed I was bad, I was guilty, I was inadequate, I was immoral. I criticized, I judged, when what really was going on, and what I think is really going on in most of my patients now, is the lack of strength to accomplish a very difficult mission. You would not morally condemn someone if they couldn't lift a 1,000-pound rock up. If you told them to do so, they would say, no, I can't, I'm not strong enough. If you were to say, well, you must be a bad person, that would be absurd. but something parallel seems to be happening in adult relationships. If you don't have the strength, if you don't have the courage, if you don't have the will, if you don't have the internal resources to deal with the mourning and the loss of what has come before, you then don't have the psychic strength to engage in relationships that are healthy and strong, but that take a great deal of developmental maturity to accomplish. And so I think I've become considerably more humble about what's possible in therapy and what's possible in anybody's life. I'm hopeful because of these theories give us the idea that developmentally we can always get better, but it's balanced a little bit with the idea that getting better, getting stronger, is much more painfully difficult than we thought, and orders of magnitude more difficult than simply understanding the right thing to do and then just go ahead and do it. That to me seems simplistic to the point of absurdity, and it doesn't work. Getting at these deeper, more difficult things has a much higher chance of working. Very few guarantees in this field. So back to Winnicott for a moment and his transitional objects. As we move through the development of the child, one of the things that becomes clear is that there is not just developmental meaning in the separation individuation phase, but that the possibility of real creativity is in that space, that transitional space, that creative space, that tension between oneness and separateness. And Winnicott came up with this idea of a transitional object, what most of us understand, the teddy bear, the binky, the thing that the child needs, that in the child's mind is a object or is a fantasy of a replacement mother figure that soothes the child. Winnicott begins his discussion with transitional objects in a way that allows Scharf to take them into the realm of adult sexuality. Is adult sexuality potentially the same kind of transitional experience? Is it also the potential creative space where healing can happen and growth can happen? And the danger that if we're not healthy, we attempt not to use the experience for creativity, for joy, for building more mature relationships, but as manifestations of control and aggression and hostility and resistance to change. The quote is, "The degree of flexibility and security of alternating closeness and distance in the original mother-infant bond is echoed in the transitional phenomena of adult sexual life." Page 32. Now, I think that also gets manifested in my patients. I have an adult male patient who is in his early 30s, and instead of achieving a playful intimacy with his wife in sexuality, which he has to some degree, but what we've been struggling with lately is his tendency to go off by himself and masturbate. That the connection to the mother, to the wife, is evoking in him the dangerous separation from mother, and sexuality has been associated with that painful abandonment dynamic. That if he commits to this, if he allows this intimate sexual connection with his wife, he then is evoking an almost imminent feeling of catastrophic abandonment. So he withdraws to masturbation, which contains him, which he feels like he can control. And he is halfway toward sort of recognizing the infantile precursors to this problem, that he came in initially brutally judgmental of himself. Well, I'm just a bad person. This is just bad. This is just wrong. I'm committing a sin here. And he was just brutally judgmental of himself. And it took the longest time for us to see the meaning of the thing that he was doing. And once we did, then it shook loose, because the fear of abandonment was something that wasn't real in the moment. It was a memory of an abandonment that he had already endured. he could not be abandoned that way by his wife, though it felt so real to him in what Freud called the transference, or what Klein called projective identification, that it became sort of stifling and terrifying to him, causing his withdrawal. I have a female patient in her early 50s, and she had something similar. Alcoholic father, kind of a mean-spirited, shrewish mother. And she also attached to sexuality a meaning of hostility and aggression. So in two ways with her, she would withdraw from sexuality. She would not participate. Her sex life was kind of cramped and minimal, and she would sort of go along with the program and would sort of allow sex to happen and didn't seem averse to it, but certainly didn't participate in any sort of meaningful way with her husband. So her withholding, I think, and we're still struggling with this, her withholding was both fear that sexuality could be that kind of hostile and dangerous, but also perhaps fear of her own hostility. In a way, she was protecting her husband from her own aggression that she felt all too close to. Again, what looks like a problem on the surface between the adults in a sexual relationship inevitably has these infantile precursors, these tendrils that go down. Figuring that out, bringing that to conscious awareness, may be the only road to repair. Two other clinical case examples. Male patient, early 50s, had a compulsion. It was his wife. There was actually two patients. One, a woman whose husband demanded sex every day. It was absolutely a compulsion. And he would be relentless in sort of pursuing her around until she submitted to sexuality. And it became clear to her through our work that what he was doing had nothing to do with sexuality, really. That it was a separation individuation question, that his mother had also had great difficulty with him in this phase, and that what he was doing was using sexuality as a fantasized connection to the mothering figure in fantasy, which was his wife. This was all tremendously infantile and pathological, and all of these early childhood derailed dynamics being projected onto the adult sexual relationship, which took the longest time to make sense of. His response was just, "I love having sex with you. Sex is great." But when she didn't feel like it and said no or resisted, the urgency of his demand became part of what she initially understood to be a symptom of a problem, and not just he liked sex a lot. Had a male patient who had the same issue. He demanded daily some sexual access to his wife, and it seemed in his case to be a manifestation of an inadequate sense of identity. Ironically, in some ways, that his sexuality and identity, which I have suggested are always two sides of the same coin, had been melded in a way where unless he got the sexuality, he didn't feel like his identity was stable enough to sustain, that made him a man, that made him, and he experienced it as the confirmation of his concrete existence, without which he thought he had this fantasy of sort of floating away into nothingness. Again, all of these dynamics, powerfully driven by childhood developmental dynamics. Fourth or fifth patient who was struggling with premature ejaculation, which obviously interfered with his sexual life. It didn't come to light, interestingly, until his wife complained about the sexuality, which he didn't complain about initially in therapy. She ended up with her own withdrawal, her own inhibition, which he complained about, and then his premature ejaculation came out as part of the larger investigation of their relationship. And in both cases, the woman withdrew because she was feeling a sort of punitive withdrawal from her partner, which she had felt In her childhood, this evoked all of her anxiety, all of her abandonment anxiety. So she withdrew to defend against anticipated abandonment, which she had already experienced, but which now she assumed was coming from her husband, and in a way it was. And the husband finally understood that his premature ejaculation was not just a physiological problem. He had a medical evaluation. There was nothing physiologically wrong with him. But it also reflected an internalization of his parents' hostile and aggressive sexuality and control. He controlled the sexuality by withdrawing. He protected his wife from his own aggression by minimizing the sexual contact. None of it worked. None of it worked in reality at all. In both cases, the adults were projecting their inner object relational childhood experiences, long since repressed into unconsciousness, but still active in controlling their currently adult interactions. And these were patients often in their late 40s and 50s. These dynamics had been alive since childhood. Again, a recognition of Freud's brilliance in recognizing the power of the unconscious. These childhood dynamics laid down very early are as alive as if they were laid down yesterday. And I think my patients' sexual symptomology, as well as their healing of these things once it gets at, is as good a proof of that as we're likely to get. Chapter 5, Beginnings of Sexual Relatedness in Infancy and Childhood. To begin with, sexual activity attaches itself to functions serving the purpose of self-preservation and does not become independent of them until later. Sigmund Freud, 1905. 3 essays on the theory of sexuality. What does that mean exactly? To begin with, sexual activity attaches itself to functions serving the purpose of self-preservation. Well, baby at a mother's breast is about feeding. A baby at the mother's breast is about nutrition and the emotional connection, the physiological protection even that a mother provides. Nothing sexual about it. And yet, the precursors, the seeds of sexuality, are very much present, and they do not become identifiable as sexual until considerably later. Freud is saying, look closely and you'll see the seeds of sexuality. The successes and failures of adult sexuality both rest on the foundation of mother-infant and family-child interaction. This is where, frankly, this is where the research gets a little confusing and hard to tease apart because of that idea that we've got a baby in such a primitive state developmentally that it's not really possible to tease apart what has to do with fight-flight syndrome, aggression, sexuality. It's all a bit of a jumble in there. But I think if we're attuned to the reality that fairly quickly it begins to differentiate, we can see things happening fairly clearly. Another element that Freud initially touched on, which I think has been confirmed by most subsequent research, is that the human body, this is actually kind of funny, the human body is a total erotogenic zone. Is that it begins in Freud's psychosexual stages of development. The mouth is the initial erotic zone. It shifts in the anal stage to the anus. And then the genital phase, the focus of the child shifts down to the genitals and the discovery of masturbation, starting at 18 months and moving through the Oedipus complex. Okay, but I think now it's pretty clear that if sexuality is our identity, then we are from tip to toe an erotogenic zone, that we are sexualized creatures everywhere all the time. And I think I perhaps suggested this in the lecture on child development, or a lecture on earlier on sexuality, the idea that you could ask this question of yourself: what part of your body would not feel good if kissed by your partner? If you think about it for a minute, the answer is, well, every single part would feel good if kissed by my partner. My whole body is evocative of erotic dynamics. And that, one of those little points that seems obvious, but also suggests that Dr. Scharf is onto something here about sexuality being almost a totality, or at the very least integrated fully with a sense of identity. And I also think we can start seeing that much earlier than we ever have before if we're paying attention. It is true that if there is a catastrophic failure of nurturing care, if there's a catastrophic failure of containment, if the mother and father do not adequately care for the very young child or infant adequately, then the quote is, major deficits in general development make specific sexual development clinically irrelevant. We end up with psychosis. We end up in primitive psychotic dynamics. We end up in schizophrenia. We end up in severe forms of autism. These are things that make sexual development impossible to tease apart because the fundamental failure is so early that any identifiable sexual development is made impossible. You're not going to be able to tease apart any independent sexual life in a paranoid schizophrenic, at least very successfully, I think, at early stages of treatment at the very least. So when can we see these things begin to tease apart in a very young child? And I don't think we have to wait very long. Initially, the baby nurses and then falls asleep. It's quite beautiful to watch. But at some point, relatively soon, certainly before a year old, the baby will have a little play with the nipple before beginning to feed. The baby will discover the mother's face, chin, lips, earlobe. There's almost an erotic playfulness to the baby's explorations of the mother's body. There is no question that the baby will explore, will be desirous of playing with and exploring the mother's body. There is, if you look at all closely, an erotic component to this that's unmistakable. There will then be a transition to the baby exploring its own body as an erotic element. The unmistakable and valid child development research has confirmed, I think, beyond any dispute, that babies, boys and girls, around the age of 18 months, give or take 18 months, will discover their genitals and will engage in behaviors that are unmistakably masturbation. They will find them, they will manipulate their penis or their clitoris in ways that simply cannot be called anything else. What's going on in their minds? We have no idea because we can't look in that way. But it seems unmistakable that there is some kind of erotic fantasy. Now, I'm going to maintain again that it cannot be anything like a fantasy of adult sexual relationships. It's impossible. It's impossible to imagine cognitively. It's impossible to imagine the neuronal structure of the infant's brain being that complex. It's impossible because it seems that there is no way for the infant to take in that fantasy in any realistically accurate way. I suppose there are some children who get exposed to adult sexuality, but that seems at least unlikely in a way that would call into question the child's construction of erotic fantasies. One bit of research suggests that there is a problem in fact, with children who don't masturbate. For so many years, masturbation in children was considered evil, a sin, a sign of illness. And strange, now it seems exactly the opposite, that there is significant clinical research to suggest that 18-month-old and beyond toddlers and very young children who do not masturbate are almost always shown to have a fundamental dislocation in their relationship to the mother. Something's very wrong with the maternal relationship to the child if there isn't a healthy, normal movement into some form of autonomous masturbatory activity. We then move into something like the Oedipus complex and the Oedipus development, which becomes for the first time in a child overtly sexual. And I don't think anyone who's ever had children can argue that if the children are at all healthy and if the atmosphere in the home is at all healthy, at about 3.5 years, boys and girls discover their genitals. They discover sexuality. They discover and get something about the adult sexuality that they did not know before. I think it's very clear with young boys and young girls that they will attempt to get in between parents. As parents hug in the kitchen in the morning, the children will attempt to get in between, and it is accompanied, that effort is almost always accompanied with a claim of ownership to the opposite sex parent. The son will step in between the mother and father and say, "Mine," and try to push the father away. The girl child will do the same thing with the mother. These are unmistakable signs of attempted sexual possession. Not overt and specific and concrete in anything like the adult way, but unmistakable nonetheless. How the child is assisted to transition through this phase is essential for their adult development. There should be an entire separate lecture on the mysteries and details of the Oedipus complex. But for our purposes now, I think Freud was accurate, at least in that he recognized that this developmental transition was essential for adult mental health and healthy adult, late adolescent, and adult sexual functioning. And more than that, and perhaps in addition, central to that, it appears that the child's initial curiosity is always about the mother's body. The child is curious. You can see it in their eyes. They want to know things. Little children are curious. They ask the why question to the point of distraction. How are the parents' responses to the child's curiosity about their bodies? What are the parents' responses to the child's curiosity about sexuality generally? And I'm going to take a little bit of a stretch here, but there is significant research to suggest that there's no such thing as a learning disorder. Yes, I know millions of children all over the country are diagnosed with learning disorders every year. But a way to think about these is not that these children have any kind of cognitive, neurological deficit at all. To my knowledge as of now, there is no evidence, none, of any direct causal link between any neuronal structure and a learning disorder. There may be correlations, but there's nothing that could scientifically and with some validity be pointed to as a causal link between any neurological structure and the complex behavior that is now labeled as a learning disability. I think learning disorders are all disorders of anxiety, all disorders around the parent's response to the child's initial curiosity about sexuality. If the child is punished for masturbation, if the child is threatened with abandonment or other threats, if the child is given the impression that parents will abandon that child if this behavior continues, if they're demeaned or discouraged in aggressive ways from inquiring about sexuality, the child then not only incorporates a potential bad object from the parent's hostility, internalizes it as a bad object as part of him or herself as bad, but also comes to associate learning with punishment, comes to associate learning with the anxiety of parental abandonment. That's a learning disorder. When children have had that experience, there is, to me, the most obvious causal link. In the absence of any neurological, scientific, or cognitive evidence of brain dysfunction or neurological disorder that can be tied to this, this is the only thing that explains that childhood pattern of non-learning or resistance to learning or fear around learning. It seems clearly connected to the atmosphere in the home around the child's initial curiosity about the mother's body and subsequently about sexuality itself. You want to fix American children's learning disabilities? Fix the parental response to sexuality. There's, to me, a direct connection between those things. Chapter 6, Sexual Symptomatology in Childhood and Adolescence. We're moving now to what happens if the child's developmental dynamic, if their development of identity and sexuality becomes derailed. And in this chapter, he lists simply a series of several disorders that he thinks are tied in a way I've just described, tying a childhood disorder to a psychosexual developmental dynamic. He does the same thing with very common childhood disorders. Parents will often take children to clinicians if they believe the childhood experience of masturbation is pathological, is inappropriate, is too much. And sometimes it is. But if it is a potential opportunity for the clinician and the parents to see the meaning of that excessive masturbation as a function of the child's desperate attempt to contain its own experience of anxiety. It feels good to the child. The child's drenched in anxiety. Why? Because its experience of the parents is leading it to feel anxiety, that there is danger, that there is a lack of parental good enough objects in them, and there is a lack of sufficient nurturing care for them to contain their own anxiety, and possibly environmental impingements that evoke more anxiety in them, and the masturbation or sexual acting out in young children becomes the symptom of those other anxiety disorders. Sleep disorders. Why will some children very early refuse to sleep alone? Probably dozens of potential possibilities. One of the ones that Scharf discuss is the possibility that at the Oedipal phase that the child knows something is going on between the parents. He doesn't know what it is, but he knows he's being excluded. So the sleep interruption is really an attempt by the child to separate the parents and to reforge a symbiotic bond with the mother, and excluding the father or excluding the mother, depending on the gender and its dynamics. And so we have to recognize that the child's refusal to sleep, or the waking, or the dreams, nightmares, night terrors, that these will all have meanings developmentally. And there may be several here. I don't want to get focused on sexual development to the exclusive disregard of other things that it might in fact be. But to exclude the sexual component of these dynamics, I think, has been the mistake more likely to happen. Back to the masturbation for just a minute. One of the other examples Dr. Scharf uses is the attempt not just to contain internal anxiety by excessive masturbation in the child, but also in some, I think, more disturbed children, in the experience that they get with their parents of some kind of disturbed sexuality. The masturbation then becomes the screen on which the child projects its own derivative disturbed sexuality, and it's telling the parents something's wrong with their sexuality that is now impinging on the child. That often is going to be something that disturbs the parents quite as much as the child is disturbed, but I don't think there's any way around holding that out as at least a possibility. Okay, moving on. What happens if a young boy, for example, as is sometimes the case, will not accept what 99% of the other boys accept, their role as boys? They tend to more naturally play with trucks and animals and bricks and figurines in a particular way. And girls play with dolls and other things in a more natural way. This isn't a function entirely of cultural prejudice and misogynistic male dominance. Researchers at the University of Washington, with a cognitive behaviorist orientation, have identified very clearly, very early, before children can at all be exposed to the kind of cultural manifestations we might think are a cause of this, they seem to innately gravitate toward gender-specific toys and activities. There is something biological about gender identity that we simply cannot deny anymore. What happens when a boy goes counter to that? What happens when we have the effeminate behavior in a young boy, or say around 5 years old? What happens when we have bedwetting? Now, the effeminate behavior, or dressing up in girls' clothes, that can, I think, more readily be seen as something in the child's psychosexual development where he is being identified with the mother figure, disidentifying with the father figure in terms of gender identity. This is a problematic developmental thing that has to be addressed. We have to ask the question, why is that happening? Is the mother reacting to the father with hostility? Is the boy identifying initially with the father, now abandoning that masculine identification to keep a connection to the mother whose misandry, whose hostility to men, has long since been manifest to the male child? You've got to look at the meaning of the behavior in the context of the maternal and paternal relationships, or there's no way to fix it. Enuresis, the bedwetting, most of the researchers now suggest that unless the child can be physically examined and have some plumbing problem diagnosed, if there's an actual damage to sphincter muscles involved in urination, unless something like that can be discovered, which is almost impossible, it just doesn't happen practically, that bedwetting will itself also be a sexual development symptom. Later on in development, this happens often enough to be a category of concern. What happens when siblings engage in what might look like a little incest? What happens when there's sexual play? What happens when siblings play doctor? If they're very, very young, one can understand it as curiosity. If it gets a little older, inevitably there's some concern about sexual acting out. I think when it comes to premature pregnancy, and there's going to be a large section in one of the subsequent chapters on this subject, there's no question about that. Early adolescent, premature sexuality, and certainly premature pregnancy will, without exception, and there aren't very many areas, there aren't very many places in this study where one gets to be even a little bit dogmatic. There are always exceptions to the rule. There are always considerations that might cause an exception to the bell curve, that yes, this might be common, but there are always exceptions one needs to be mindful of. I think the literature now is pretty consistent that teenage sexual acting out, and I mean early teenage sexual acting out, and sexual acting out that results in early teenage pregnancies are always pathology. Either directly, indirectly, or will subsequently become psychopathology if not addressed aggressively and effectively. Let us turn to Chapter 7. The effect of early experiences with parents. I want to be careful here because I think most researchers, and Dr. Scharf is one of the best of those, I think there's a tendency to want to focus on pathology. I think it's easier. I think we can see pathology easier. It's often an easier subject of research. We can contain it. We can bring it into a lab. We see it in our clinical practices. It's the subject of our conferences. And so one can easily get the impression that there's more pathology out there than there is. And I don't want to become pedantic about sexual developmental pathology. I think the vast majority of people are good enough parents who have good enough children who grow up to themselves create good enough relationships where the sexuality does what it's supposed to do. And I think any society that can't say that is on the brink of collapse. So maybe as just a brief timeout and a reaffirmation that in the vast majority of people's lives, I think it's clear that mostly we get along adequately sexually. Mostly sexuality achieves what it's supposed to in a good enough relationship. and mostly parents provide what their children need in a good enough mothering, good enough containing environment, atmosphere, so that they can grow up and function adequately themselves as late adolescents and adults. That being said, it is also true that children with pathologies graphically represent and show with some clarity the developmental sequence that we're talking about. So with that as sort of a caveat, let me proceed. And perhaps this is also an appropriate point to discuss the transmission of values into a child and the effect of those cultural values on psychosexual development. Masters and Johnson, very famous sexual researchers, believed that a rigid cultural or fundamentalist religious belief at the cultural level could contribute directly to a child's pathological development sexually. Dr. Scharf doesn't think so, and this is one of the areas where the field is a little bit split. I tend to side with Dr. Scharf on this myself, that whatever effect the culture has on the child, it is mediated through the parents always. The culture isn't in the room with the mother and father. The culture certainly isn't in the room with the mother as object of the nursing child. Certainly the mother is affected by culture. No one doubts that for a minute. Please be clear about that. But it seems like the mediation is attenuated, and that it is the primary relationship between the parents and the child that is the source of transmitted values. And again, the word values seems like a cognitive construct, a philosophical position, an ethical one, a religious one even. That's not what Scharf is talking about here at all. Scharf is talking about the internalization of an identity, the taking in of emotional connectedness at a level so much below, so primary, just a step up biological in its nature, that the question of values does not arrive in any effective, meaningful way until the child is in adolescence. The child's growing psychosexual development is going to always be at the profound emotional level of introjection, of identification with parental dynamics that are taken in unconsciously, not the subject of lectures, not the subject of learning in any cognitive way. I will grant culture its effect and as a factor, but it seems to be the intra-psychic life of the parents and the life as reflected in the relationship between the infant and child and the parents is where the psychosexual development happens in all major particulars. What happens if there's trauma? And I think the weight of the literature it can be described and summarized this way. If in the child's experience there's a kind of trauma, we have to ask several questions first, because rarely is an individual isolated trauma in any causally linked way the direct result or results directly in a sexual derailment or dysfunction or disjunction, as Dr. Scharf says, for several reasons. One, the accumulation of experience inevitably forces us to focus not on the trauma itself, but the context of the child's entire family, what has been accumulated up till then, how the family responds to the trauma, the subsequent accumulation of experience around the trauma, precursors, and what happens after, the sum total of those things in the child, the nature of the trauma and the nature of the child's reaction to the trauma. These make the question of what does trauma do to sexual development an immensely complicated thing. It will not do to say, because the child was traumatized, especially in the context of sexual trauma, sexual abuse, sexual assault, child rape, child molestation. I think the vast majority of uninformed people in our culture now, and frankly a good a good number of folks in my field even are under the mistaken assumption that a trauma like that in childhood will directly result in some sexual deviation or perversion in adolescence or adulthood. There is no truth to that in the literature that I can find. Is it a problem? Sometimes, yes. Is it a serious problem? Frequently, if it's a significant trauma and the youth is vulnerable, no question about it. But it's going to have to wait to see what the answer to all those other questions are before we can make any have any diagnostic clarity about this trauma in the context of the child's accumulated life. Chapter 8, the adequacy of the parents functioning as parents. There's two issues in this chapter that I think are worth commenting on. And the first is the neglect in taking care of the child and the child's body. What happens? What happens as a general matter in the development of a child's mind and sense of identity if the parents are negligent? If they simply don't get, or themselves have not had adequate parenting, if they have themselves not had good enough care, and they simply allow that intergenerational transmission of trauma to roll downhill, sadly, what goes on in the child's mind and experience? What are the derivatives of some fairly simple, and I think lately all too common, neglect of the child's self-care, of the child's care of the body? Well, the answer, and I just hinted at it there, is the child does not take in a containing, caring object adequately. The child becomes negligent in the care of its own body. The child does not take in itself as a good object deserving of care. And that's where the problem is. It isn't whether or not the child gets a regular bath, although that's important. What's important is, what is the emotional meaning of that neglect that the child takes in? Does the child take in, I'm not very important to my child, I must be bad? I might be angry at my parents for neglecting me, but I'm too scared and vulnerable for that, so I must be a bad child. It must be my fault that they don't care enough about me. The developmental ramifications of that internalized bad object, of that hate and anger turned against the self, are depression, among other things, possibly masochism. Only when I suffer do I get love. If it becomes too much, then we get a fragmentation of identity. And I guess one can become hypersensitive and hypercritical and hypervigilant and obsessive-compulsive about the care and feeding and nurturing of a child, which has its own problems, certainly. So what I'm suggesting here is attempting to take a good hard look at what the needs of the children are. Are teeth brushed every day at a minimum of morning and night? Are there regular baths taken? Is the diaper left on too long? What does that mean? I don't know. Is several hours? Yes, way too long. A half hour? Probably too long. Does it have to be taken off in 30 seconds or the child will be pathologized? Of course not. Okay, so I'm struggling for a balance in the zone of reasonableness, in the zone of reality. Here's the key. What are the reality components to the child's needs developmentally in terms of care of their bodies? That is hard to understand if the parents themselves are not reality related. If they themselves are operating in their own highly defended, highly projective transference dynamics, if they're obsessive compulsive, if they're depressed, if they're acting out sexually, then it's impossible for them to that degree to honestly and accurately assess the child's needs. That's the problem. I don't think you can accurately assess the child's developmental needs if you're not starting from a place of fundamental, basic psychic health yourself. When is intruding on the child's development a good thing, meaning you care about what's going on and you're interacting with the child in a caring, loving, developmental enhancing way? And when are you intruding, impinging? When are the parents' neurotic responses being inflicted on the child's development in a way that forces the child to erect a false self and derails both their normal and also sexual development? I think these questions have to be asked, or there isn't any way to honestly answer the question what the child needs. The more horrible, frankly, example that Chapter 8 addresses is violations of the child's integrity, real and symbolic incest, and also, I think, sexual abuse by external actors. This is the area probably most developmentally difficult for anyone to even talk about, think about, or feel about. What Freud understood initially is that is the inevitability of sometimes intense but pervasive sexual and jealousy feelings between the children and the parents that carve out and affect the child's development, and frankly affect the parent's development on a continuing basis, at least after 3 years of age, and Klein suggests much earlier. Those have to be managed and understood. If they are not, if they are acted on, if children are occasionally or ever used as sexual objects by their parents, the effects on the children are inevitably and almost without exception traumatic to the point of borderline personality disorder in the children. This is one of the examples where I believe the trauma to the child is directly relevant to the subsequent pathology. But I will maintain the other as well, that the context counts. Because when the parents are in fact the sexual abusers, and this is 99% the father, and I think maybe more prevalently the stepfather in these cases, I think that's statistically quite clear. What the child is experiencing is not just the trauma, but the entire psychosexual dynamic between the parents that forms the context for the trauma, is inevitably part of the trauma. When the child is used to meet the parent's sexual needs, the destruction of the child's integrity and the developmental derailment of that experience, the literature now, I think, is unmistakable. Children who have that done to them, have that horror inflicted on them, will develop something like serious mental illness. Borderline personality disorder is the most common derivative of that. And that's going to require significant therapeutic intervention. The other question that may be more likely, the statistics on this are almost impossible to get accurately, the more complicated problem is the effect of sexual abuse, molestation, or if penetration is involved, rape of a child, by an outside actor. And one must look at the nature of how outside that actor is. If it's an uncle, if it's a family member, a grandparent, if it's someone with whom the child has consistent contact, then the differential between that trauma and the parental abuse is indistinguishable, I think. If it's a stranger, then we get back to the position of trying to recognize the context, the age of the child, the frequency of the trauma, the quality of the child's developmental progression prior to the trauma, how the trauma was addressed, if it was addressed, did it come to light or did it remain the child's secret? That will frequently cause a significant problem in subsequent psychosexual development. Once discovered, and at what age, what is the nature of the parental intervention? How is the child helped to work it through? Do the parents assist? Do they get therapy? Do they deny it, which re-traumatizes the child in a variety of complex ways? The last consideration is when sex abuse happens within the family, it appears absolutely unmistakable now, and this is very troubling and problematic, is that it is a catastrophic failure of both parents. Frequently, in almost all cases, the abuse is perpetrated by a father onto a daughter. Not always, but most of the time. What is the mother's role in that abuse? And the answer is troubling. The father is not just pathological. In most states, he is a rather heinously considered criminal. I don't think anybody argues about that very much. They shouldn't. The question, the complicated question becomes, what's the role of the mother? And here's where it gets complicated. Because the assumption is no mother doesn't know it's going on. They're in denial about it, but it is impossible to imagine that they don't know. Freud was right about this. They don't want to know, but that's repression and denial. That's not actually not knowing. The question then becomes, how is it that they don't know? And Scharf suggests several possible meanings. One, a woman herself so deprived sexually, so pathological, both in terms of character and sexuality, that she cannot function sexually and effectively turns over the daughter to the husband as a substitute. The aggression against the daughter is a possible meaning as well. The likelihood here is that this is one of those examples where accumulation of multiple meanings is inevitable. It's not going to have a single meaning, other than the assumption that meaning it does in fact have, and that in the case of at least family levels of incest, parents are equally liable, equally responsible, and the blame goes in both directions equally. The child deserves honesty, and one parent does not get to avoid the responsibility of a household wherein that child was brutally and unfairly abused. So I think at that point we should take a break, move to chapter 9 in the next hour, and move on to the other issues in what I still think is the most profound text written on sexuality, even though it is tremendously troubling and difficult. The most important text since Freud's theory of sexuality in 1905. Thank you.